Hi, I would like to share with you my cancer thyroid story, and also I would like to create thyroid cancer awareness. This affects thousands of people throughout the U.S. every year, also children. But let me start by telling you my story. In 2003, I was not feeling too good. I was feeling kind of tired. I had body aches. So I went to my doctor, and I told her about how I was feeling. And she asked me about my family history, and I told her that in my family, I have a history of cancer thyroid and thyroid nodules. So she made some blood tests on me to see how my thyroid levels are, and they came out perfectly well. And so she decided to make a sonogram of my thyroid. When the results came back, it showed that I had some thyroid nodules. So she sent me for a biopsy, and the biopsy came out good, no cancer. So she recommended that every year I would have a sonogram of my thyroid and a biopsy. That I did every year until 2007, the end of 2007. My sonogram revealed that my nodules, my older nodules, were much bigger, and I had some newer nodules. So the doctor explained to me that a biopsy really won't reveal if it's cancer thyroid because the nodules were really big. So she told me, based on my situation, it would be a good time to have my thyroid removed, have surgery. So I thought about it and I agreed with it. And I had surgery. I had my whole thyroid removed. And when I was about to leave the hospital with my husband, the doctor walked in, and he told me that the pathology test came in and that yes, it was cancer thyroid. The pathology test revealed that I had variants of follicular carcinoma, papillary carcinoma. So the doctor told me that the next step will be to have a TG test done in a few weeks. So I had that test done, and it revealed that my TG levels were really sky high, which could be that I still have remaining cancer in my body, thyroid cancer. So she recommended for me to have the radiation iodine treatment. I had to go to the hospital and take 2 capsules of radiation iodine, and after I took those capsules, I had to go straight home and isolate myself in my bedroom for 1 whole week. No contact with anybody. So that's what I did. And after the radiation treatment, approximately like 2 or 3 weeks after, I had a full body scan to be sure that the radiation was working, that the treatment was working, and yes, everything was good. So now I have to wait until 2009 to know if I'm cancer-free. So I have a little bit of waiting to do. That's the most stressful part, but I try to keep each day positive. Now, my most important message here is that we need to create thyroid cancer awareness. That's very important. I myself, I did not know that I had it if I wouldn't have told the doctor my family history. And I could not feel any bumps on my neck. I did that examination, the doctor did it, and we couldn't feel anything. So it's very important to have ourselves checked with the doctor, or we could even do our self-neck examination. That's why I created a website. It's www.thyroidcancerawareness.com. I'm going to repeat it. It's www.thyroidcancerawareness.com. On the first page, you will see how to perform a self-neck examination. You could do it yourselves. It's easy. And if you feel any bump, please consult your doctor immediately. And it has very good information, this website, that has helped me to cope with my illness. So I'm sure that all of you out there, you will benefit from this website.